I'm always struck by when I hear that someone was shot, stabbed, I get a call to the emergency department, that despite my desire strongly every day to think it's going to be different, it's almost invariably a young man of color that is being stabbed or shot, intentionally, unintentionally, circumstances known, circumstances not known. Intentional trauma is always a story, and the story is not one of just that incident. Within the context of violent trauma, there are times when some cities in America feel like a war zone, where everyone in the community has been affected or knows someone directly who's been affected by violent trauma. And when you have that pervasiveness of knowledge of trauma, it affects whole communities. And so I think police officers have to be very sensitive about how they interface with the victims of trauma. Again, largely because the issue is that it's not just isolated. It's often in a larger context, and families and communities are dealing with that individual incident in the context of a slew of past incidents, past hurts, past pains. And trying to come to grips with all of that is actually incredibly challenging, and many of us can't even fathom what that may feel like. I am blessed to have 3 boys. I'm challenged every day that when someone sees Trey, we call Selwyn Rogers III, my eldest child, Trey, who loved dearly, incredibly passionately about his salt of the earth. You know, of course, Dad would say this about their eldest child. When the outside world sees Trey, he is African American, cap wearing backward, with a hoodie, bilateral ear piercing. And what do they see? They could have easily seen Trayvon Martin. However, Trayvon Martin got viewed that fateful night when he was shot to death. That fundamental disconnect leads to a disproportionate amount of violence bestowed upon African American men of color in our society, where unfortunately, when those young men interface with the grocery store, the police officer, disproportionately a set of interactions happen that are almost scripted and have less to do with the individual kid and more to do with society's biases about who that kid represents. Instead of being someone's mother, someone's mother's son, someone's brother, they're the African American kid with a hoodie who seems threatening. And I often lament that in my own experience as a fairly successful surgeon trained at the Brigham Hospital, Harvard Medical School grad, all those degrees really mean very little. Because despite walking with my $100 shoes and $50 pair of socks, yeah, I like socks, and slacks that are custom fitted, and a crisp white shirt, Josie Banks, and a $70 tie, I will still be approached if I don't have a white coat on as a person here to get the person's tray. And in the context of that reality every day, if I am portrayed that way, what is a poor kid, 16 years old, with a hoodie, bilateral earrings, portrayed as today? And that, unfortunately, is a disconnect about how we treat kids in a context that actually sets them up to be victims of violence. One of the things I try to do with my patients always in these interactions is, first of all, I say, I'm sorry this happened to you. So I acknowledge that there's some sadness there. The second thing I often do is I encourage them around the fact that, boy, this is a second chance. This is a big deal. You could actually do something differently here, because the alternative is a lot worse. One question that we don't ask enough: what do you aspire to be? Who do you aspire to be? And by asking some of those fundamental questions, I think these moments are incredibly powerful ones when people can actually make fundamental changes. And it's those moments of reflection that actually make us all better. One of the things that is easy for us to do as healthcare professionals is to laud our successes. We got the bullet out, we stopped the blood vessel from bleeding, we sewed up the bowel, you're going to be fine. I actually do that, but I also say, you may not have been fine. This may not have gone this well. You're actually incredibly blessed to be alive, not have a colostomy, not be paralyzed. Or if you do have a colostomy, you're blessed to be alive with a colostomy. And in the context of giving the reality check about what this means, what this event means, the assault, the stabbing, the gunshot wound, and what the alternative could have meant, gives people a chance to actually go within and seek whatever that inner peace that they don't currently have to begin, hopefully, a long journey towards finding that inner peace.